Can someone with a neck fusion get adjustments? Yes, 100%. However, the adjustments that you get if you have a prior surgery like a fusion or even a discectomy, laminectomy, artificial disc, whatever it may be in the past, your adjustments might be a little bit different. We carefully evaluate all prior imaging, take new x-rays, possibly send for new MRIs. And that's before we basically adjust anybody. We don't adjust anybody without x-rays at the bare minimum. And so it's very, very important to us that we do our due diligence to make sure that, number one, we know what we're doing, and number two, we don't do further harm and cause more damage or more injury. And with post-surgical patients, yes, over the last 11 years, I've seen hundreds of them, post-fusions, laminectomies, discectomies, artificial discs, basically any kind of spine surgery. In the past, I've seen it. And in reality, you have to take care of your spine post-surgery. And what's really frustrating is that a lot of surgeons, they'll say, don't go to chiropractors or don't go to an osteopath, and that's just stupid, because there's such thing as adjacent joint or adjacent disc syndrome, which only happens post-surgery. And if those patients don't take care of those joints above and below the surgical sites, then those discs and those joints and those areas of or sections of the spine will also start to deteriorate and degenerate and wear and tear. That's why they call it adjacent joint or adjacent disc syndrome. So reality is, yes, in fact, everybody after having a spine surgery should be taking care of their spine. However, you have to make sure you're going to the right chiropractor who's at least doing the due diligence of taking x-rays, looking at prior imaging, not just laying on the table, twist, crack, pop, whatever. I think that's dangerous, quite honestly. And so we have to do it correctly. Yes, I get this question all the time because of the types of adjustments that I do and that I show, on my channel, on my website, and social media and YouTube. But most likely the adjustments would be different. So short answer is yes. The much longer answer I just gave, but they might be different adjustments. And we see it all the time. We get amazing results. Our patients love, love, love their care. They've been told for years they're going to have to suffer with this pain. And you know what? You don't have to suffer. And unfortunately, a lot of people after surgery are suffering and still in pain, and we're still able to help them feel better, get better, function better. So it's truly amazing. Yes, amazing question.